we have a metabolic crisis in our culture. People are not able to take the food that they are eating and make energy from it, because that's what metabolism is. So, I'm really encouraging my clients to have their labs drawn so we can kind of see where they're at.
Doesn't matter how clean the food you're eating. If your nervous system is dysregulated, all these other components can start fraying and get out of sync.
I want to be strong. I want to be fit. I want to be able to paddleboard when I'm 80. I want to be able to lift my paddleboards onto my car. I also don't want cancer, and I don't want dementia. So I act accordingly, right? So what does that look like? Strength training, blood sugar regulation. Alzheimer's is type 3 diabetes, okay? And sweating in my sauna. Dr. Amen from the Amen Clinic said after hundreds of thousands of brain scans, sweating is the best way to detoxify the brains.
Hello, everyone, and welcome back to another episode of Wellness for Life. I'm your host, Niki Wolf, and today we are continuing the conversation in gut health, gut microbiome, and the things that we can do to help facilitate a better, more healing, most effective gut health for our bodies. And we have an incredible guest, Katja of Cleanse in Asheville, North Carolina. We are going to discuss the ins and outs of colonics, break down some controversy or some worries that a lot of people bring to the table, and lay out the foundation of what a colonic is, who might benefit from something like this, and the next steps if you're interested in taking a colonic. So thank you so much for being here on the show, Katja.
Oh, I'm excited to talk about it. I'm actually excited that there's more interest in colon hydrotherapy. It kind of feels like colonics are having a heyday on Instagram and TikTok. And actually, I do ask a lot of my clients, how did you hear about it? And they're like, oh, on Instagram. So because colonics are not new, colon cleansing enemas are not new. So thanks for having me.
Absolutely. Well, we had a chance to kind of chat a little bit before. And so as a colon hydrotherapist, you have that skill set, but there's also quite a background of, medical expertise. I'd love for you to kind of lay that foundation for our listeners of what you were doing prior to colon hydrotherapy and kind of where you're at now.
Okay. So I have been a registered nurse for the past 2 decades. I worked in women's health and acute care, mostly labor delivery, postpartum, antepartum, high-risk antepartum. I also have a background in Ayurvedic practices. I did an Ayurvedic practitioner program. I've been a yoga teacher, a massage therapist. So I've kind of dabbled in Western medicine and alternative health. But my main kind of, reason that I do the work I do now is a little over a decade ago, I actually became very unwell. I got kind of what, we see, a lot of women get that kind of chronic, environmental illness, Lyme, mold, food sensitivities, all that stuff. And it snowballed really big for me. And I was really unwell. And, I struggled for about eight years. So, in that, I went from being a registered nurse to being a patient, and I got to walk that road of chronic illness and no answers. And I have to say that it was long and hard. And my family and I spent over $150,000 looking for answers in those 8 years. And I don't want people to have to do that. So about 3 years ago, my family and I made a radical decision for me to leave my job as an RN. We moved across the country from California to North Carolina to start a slower, more intentional life. And I thought about going back to the nursing profession, and it wasn't for me anymore. And so I got certified as a colon hydrotherapist, started a small little clinic here in Asheville called Cleanse Asheville. And it has ballooned up to the point where I'm 4 to 6 weeks booked out. And I feel like I'm doing work that really matters to me, because what I have found from working in the healthcare industry for 20 years, that it really is a sick care industry. And there's a predatory aspect to it that I no longer could be a part of. And when I talk about that, it just means that there is a corporate interest in keeping people kind of on the tip of taking the medicines and in the system. And so now I am kind of on the other aspect of it as more preventative medicine.
Absolutely. I appreciate you laying that out. And I think that gives us, I mean, not just that you just dove into Eastern medicine, you have that background and that, 2 decades of experience in the Western approach. And I'm a firm believer in integrated medicine, and there's a time and a place. But when you are so immersed in it, you look at the hospitals of what we are feeding sick individuals. I mean, just that alone, things kind of open up in our eyes and our brains of, is this going to help move the needle as far as our health and well-being? And so making that shift to a slower pace of life. And clearly everything's aligned with the work that you're doing, being able to integrate your past experiences into what you're doing now with colonics. And tell us more about colonics. I think maybe some people have heard the terminology, they know a little bit about it, but I'd love to unpack that of what is a colonic colon hydrotherapy and kind of, just lay that out for our listeners.
Okay, so colon hydrotherapy is the same thing as a colonic. A colonic is basically introducing warm filtered water into the colon to hydrate and cleanse, to remove backed up waste, and to lower the toxic body burden. And, when I tell people that, people are like, well, how does that happen? Right? So there are 2 different styles of colon hydrotherapy. There's an open system and a closed system. I'm trained in both. It's my humble opinion that the closed system is more effective, because that's what it is for me personally. And so that's what I practice. It's a closed system, meaning there is a speculum in your bum that has a Y on it. Basically, there's warm water going into one part of it. We fill the body up with warm water. When the client feels full, you let me know. We let it go, and water and waste comes out of the other bigger tube. So it's a closed system. Nothing comes out onto the table. There's no smell. There's no mess. And we can see through the glass tube what's coming out. An open system, you see them more in spa type places, or doctor's offices have them. It is a fiberglass kind of chair bed situation that has a smaller speculum that you kind of shimmy onto. You, the person receiving the colonic, runs the unit yourselves. You turn the water on and off. And then when you release into the bowl underneath you. So it's open, right? There's no closed tube. There are people that prefer that, but it's my personal preference to do a closed system.
Great. I'm glad you laid that out. I remember when putting this out there, I'm a fan of colonics. I've done many of them in the past. They've been beneficial. I've done both closed and open. And I think there's pros and cons to one. I think, especially if you're starting out, I think a closed is the way to go, because then you don't have to think about anything. The hydrotherapist is running the show, and maybe if you want to try something out, I think there's benefits to either. And I guess we can unpack that a little bit. But one major question that I think or controversy that a lot of people bring up is that, one, we are losing our, or we're disrupting our gut microbiome. Maybe we're flushing out too many electrolytes, too much probiotics. Is that true?
So when you get a colonic, it's like pooping 10, 15, 20 times, depending on how much you are releasing. It's literally like having diarrhea. Yes, you're going to lose potassium and sodium. So when you leave my office, you get a little Organifi green shot, and I give you instructions on how to replace your minerals. Detoxing is detoxing. We need to replenish. That's part of the process, right? I ask my clients to come well hydrated. And if we're living a healthy lifestyle with nutrient-dense food and drinks, then our body doesn't become depleted from that, right? So as far as the bacteria goes, so whenever you have a bowel movement, whenever you poop, you're taking out your garbage. That's how it is, right? When you come see me, I'm washing out your garbage can, right? If you never wash out your garbage can, it's going to be stinky and funky. So basically, I'm giving you a fresh start. Yes, I'm going to wash out some opportunistic bacteria and some good flora. But when we leave the office and we go back to our healthy lifestyle where we're eating lots of plants, the more plants that you eat, the more diverse your microbiome is. When we are eating our probiotic foods, and when we're avoiding the things that disrupt our gut flora, like stress, like alcohol, NSAIDs, antibiotics, birth control pills, seed oils, non-organic foods laden with pesticides, smoking, then our gut flora can revive. So if you were to look at my arm under a microscope, you would see tons of little pathogens and bacteria. That's part of being a human being. So the same thing, your gut has a microbiome. And there's going to be good flora if you're healthy. Hopefully it's like 80%, right? And there's going to be opportunistic flora. But if your good flora is nice and strong and robust, it's sitting on top of that opportunistic flora, keeping it in check. So that's why sometimes if we have a stressful time in our life, our resilience is down, we drink some alcohol, we eat a bunch of sugar, then we'll get candida, right? Because the candida was already there. It's just flaring, right? And so, yes, it will wash out good flora, but I'm just going to talk about myself. I've been doing colonics for a decade, getting colonics for a decade, probably done more than anybody I know. I also have been doing coffee enemas for 7 years. I do 2 a week regularly. And I used to have terrible digestion. So that was how my wellness journey started. I had an incident traveling where I got food poisoning. And now since then I've learned that often when our body is starting to become unwell, there will be a huge trigger. And so that was my trigger. I got food poisoning, the worst you can ever imagine, in an airport. After that, I couldn't eat anything. I was that person where I couldn't eat beans. I couldn't eat FODMAPs. I couldn't eat gluten. I couldn't eat dairy. And then from there, food sensitivities, chemical sensitivities, it kind of snowballed. And the more that I have worked on cleaning out my digestion and liver and gallbladder health, which I would love to talk about a little bit more at some point, I can pretty much eat 90% of things. And the things that I can't eat, I don't want to be eating anyway because they're not good for me.
Absolutely. I love that you mentioned that. And I think there's this shift. And I did a low FODMAP diet for 4 months. And in previous episodes, we've kind of explained what that is. But I think there was this era or season to life where it was like, let's be more restrictive. I'm so sensitive to everything. Everything hurts me. And obviously there's a time and a place if you deeply have to remove certain foods out of the diet. But I think this isn't a longevity type of protocol when we are constantly eliminating and removing. I want to build a resilient gut. How can I integrate and be able to consume all types of food? And by food, I mean real foods, not the fake stuff, but to be able to have gluten, to be able to have dairy, to be able to have some of these foods so that I'm not because we know diversity is so important. And so it sounds like getting to the root of what's going on with your digestive system. It sounds like colonics and enemas were such a core component to recalibrating your system. And I'm curious too. I mean, I'd love to explore what are when you see certain clients come in and they're like, these are my major symptoms. You need a colonic. Who are those individuals? What are the ones that you're like, this is something that you should absolutely prioritize?
Well, somebody who's not pooping daily, number one. So drainage, that word I know is kind of hot on social media these days, but I focus on drainage. Drainage is how your body eliminates. Your body eliminates in a funnel, right? When you're sleeping, mostly your cells let go of all of their waste. They let go of their waste and it travels into your lymphatic system. Your lymphatic system is your sewer system. So when you wake up, just like a river that's not flowing, you have a stagnant pond of lymph in your body because you have not been moving. When you get up and you do your morning movement and your exercise, you start to move that lymph and all that waste. That waste needs to go somewhere and the body takes it to where it needs to be eliminated. Some water-soluble toxins can be eliminated through sweat and through kidneys, but most everything needs to travel through your liver. Your liver is your hardest working organ in your body. 500 jobs, probably does 200 at a time. Our poor livers were never meant to be burdened the way that they are in modern life. Every 3 to 5 minutes, all of your blood, you have about 5 liters of blood in your body, filters through there, right? Your liver's full of biliary vessels. It's got bile in it. So as it's filtering, bile is kind of like the activated charcoal of your body. All your toxins go into the bile and then it drops into your gallbladder. And then you eat something And that food stays in your stomach 20 minutes to 4 hours, depending if it was an apple versus a steak. It gets very acidic, it's churning, and it drops into the top of your small intestine, which is called the duodenum, right? The body says, oh my God, that is really acidic. Gallbladder says, I got you. Don't you worry. Your gallbladder has been churning just for you, making the right pH for you. It's very alkaline. It opens up, neutralizes that acidic food bolus so you don't get ulcers into your small intestine. It also creates lubrication so it can travel down the 27 feet of tube, right? And it also starts to break down fat and certain nutrients. So then it's sliding down that 27 feet of tube. Hopefully it's going down in 12, 16, 18 hours and out through your bum when you have a bowel movement, right? That's how you're getting out your toxins, that bile. If you are living in mold, you smoke cigarettes, take pharmaceuticals, breathing the air outside, you're being exposed to a lot of toxins, right? And so that bile can get really thick and sandy and gritty and starts to slow down. So then what happens is the stomach says, did you hear? The gallbladder is not working properly. Now we're going to have to reduce our HCl, our hydrochloric acid, because now we don't have that protection. Now your first line of defense against pathogens, foodborne illnesses, and good digestion is gone. So then I get all these clients who are coming in and they're like, oh, I have reflux, I have indigestion, I have gas and bloating. And a lot of it has to do with because your liver's backed up, your stomach got the message, your HCl is down. And so now you have all this undigested food moving through. It's feeding the opportunistic flora. So you can see that it's all kind of woven in and connected.
Absolutely. And then we get this buildup and I'm assuming why there's so many cases of SIBO and EMO and all these, because the stool and the waste is staying in there and it's starting to ferment. And then for those individuals who have that acid buildup, they think, okay, Tums is the answer, where that only exacerbates the problem. Yeah. So how do colonics come in and influence that? I also know that repetitive colonics can actually get deeper into the intestines. And so they're known to be most effective when you do them back to back. I'd love to kind of unpack that.
Right. So we talked about the funnel. Your colon is the bottom of that drainage funnel. When I give you a colonic, I'm pulling the marble out and things can flow. So when things can flow out, then the liver and gallbladder can flow, then the blood can flow, then the lymph can flow, right? So we're made to be in a state of constant flow. Our circulation, our liver, gallbladder, our kidneys. When you get stagnation in the kidneys, you're going to get kidney stones and high blood pressure. When you have stagnation in the liver, you might get anger, irritation, food sensitivities, blood sugar regulation issues, acne. When you have stagnation in the bowels, SIBO, reflux, colon cancer, even stagnation in your creativity, anxiety and depression, right? So we are made to be in that state of flow, and that's what colonics do. We pull that plug at the bottom and we let things flow. So I'm very careful to tell clients when they call me that one colonic is not going to change your life. It is a tool. It is just a wellness tool. I'm not that colon hydrotherapist that thinks that everybody needs colonics all the time and you're going to just be fine. That's not going to work. If you don't go home and do the lifestyle modifications and change the things that got you to where you are now, then it's just kind of like having me clean you out and the same thing's going to happen over and over again. Industry standard is usually just get 3 colonics as close together as you can and see how you feel. It's not for everybody. I tell people, have a colonic. If it's for you, great, make another appointment. I'm one of these practitioners where I don't believe that what I do is for everybody. I don't believe it's going to save your life. It is part of a wellness tool along with good sleep, anti-inflammatory diet, clean water, stress management, all those things, movement and exercise, strength training. My biggest pillars in my office are metabolic health. That's something I really lean into with my clients, making sure we check your fasting glucose, your fasting insulin, your A1C, and your lipid panel. I want to know, because most of my clients use the word stagnant and tired. They come in here And if they're not constipated, they still feel slow and sluggish. So we have a metabolic crisis in our culture. People are not able to take the food that they are eating and make energy from it, because that's what metabolism is. So, I'm really encouraging my clients to have their labs drawn so we can kind of see where they're at. I'm also encouraging people to have daily bowel movements. I don't have a lot of hard and fast rules. You got to poop every day. You have to. If you don't, we talked about how that bile is coming out through your bowel movements. If it's moving through there and it's staying, you're just reabsorbing your toxins, right?
Absolutely.
Yeah. So one of the things also to know is that when your bile gets to the bottom of your small intestine before it hits the large intestine, right at the ileocecal valve, it upcycles your bile. And it could do that 10 to 15 times. And if you don't have a clean lifestyle, that bile is going to get sticky, sludgy. I have lots of clients who are like, oh, my doctor says my bile's sludgy, so they took my gallbladder out. I tell clients these days, do not let anyone cut your gallbladder out unless you are dying, because it is a very important part of your detoxification system. And there are doctors and practitioners who can help you save it. You need it.
Absolutely. I'm so happy you mentioned that. We have 2 products within LifeSeasons that have bile salts in there.
Yes.
And I particularly recommend this for individuals who have had their gallbladder removed, unfortunately, but it does aid in that, breakdown of the fats and facilitation. But yeah, for those individuals who've had that removed, I think any sort of permanent change you do on your body, I think we need to be thinking a little bit more critically on that. But, earlier you mentioned enemas, and they kind of go hand in hand. What is the difference between a colonic and an enema for our listeners, and why would somebody choose one over the other?
Okay. So a colonic is something you get done to yourself by a practitioner. It is much deeper. It cleans out the whole 5+ feet of your colon. So it is water in, water waste out. It is a rhythmic cycle of cleansing with warm filtered water. I use the closed system, which is pressure regulated. And so it's not something you do at home. Enemas are done at home. An enema is usually 600 to 1,000 mLs, sometimes more, of either warm filtered water. It could be coffee, it could be chamomile tea. People do all kinds of things. It just sits in the first 12 to 18 inches of your colon, and it has so a water enema is just to help with constipation. A lot of my clients find me because they're pooping like once a week, twice a week, and they feel terrible. They feel exhausted. They don't have an appetite. Their belly hurts all the time. And so I teach people how to do a simple water enema, which you learn to hold for 10+ minutes, which can start to create peristalsis, which can help you evacuate. Coffee enemas are a completely different purpose. They are for gallbladder and liver health. When you put 600 to 1,000 mLs of organic mold-free coffee into your rectum via an enema bag, it sits in your descending colon, and there's a hemorrhoidal system that pulls it up to your gallbladder and your biliary tree. It's called a biliary tree because it connects the gallbladder, the liver, and the pancreas. It dilates everything in there. So if you have gritty bile stones, it helps kind of loosen that up. It makes your gallbladder open up. And if you remember, that's where your toxins are. You're literally getting an oil change. So you don't have to, it doesn't have to transition through that 27 feet of tube over 12 to 18 hours. It's boom. Let's get it out. It can, your liver can drain a little bit and more fresh bile can come down. It also travels up your biliary tree to your liver and helps your liver produce 600 to 700% more glutathione, which is your master antioxidant. Everything that ages you, weakens your immune system, creates disease, is oxidative stress. So glutathione is your master antioxidant to boost your immune system, to help you detox, to help you live longer and age less.
Fascinating. I know I've heard a lot about coffee enemas, and I think it's very important to clarify that you said organic, mold-free coffee, because I can only imagine if you are not using the highest quality, most purest form of coffee, that you could be causing harm with this.
The first rule of thumb with clean living is to not toxify yourself. So the first thing that I talk about with clients is, what's your food like? What's your water like? What kind of coffee are you drinking? So those things matter. I always stick I always start with the lowest hanging fruit, right? So those are the big things, like your water. We do not drink tap water. We don't drink water out of plastic bottles. Like those are things that we know now cause a lot of harm. We buy the cleanest food we can afford. And so, and then we start looking at our products. Like, what are we putting on our skin? Everything that goes on your skin, in your mouth, in your lungs, your liver has to process. And if we're giving it more and more to process, especially with women, if your body is too busy processing out all the gunk that you're putting in, you're going to have hormonal disruption, because every month when you ovulate and your estrogen drops, your body's not going to be able to eliminate that and metabolize that estrogen through your liver. So now we have, over 25% of young women, 25 around that age has PCOS, androgen dominance, estrogen dominance. And even in women my age who are perimenopausal, our progesterone is dropping, our estrogen's going up. So we become a little estrogen dominant. We don't want that to get worse in perimenopause. That's when we start getting those worse symptoms. Menopause is not supposed to be this horrific thing that's happening to women. We're just not going into it in a good way, in a good metabolic way, in a good liver way, all those things. So.
Absolutely. And I think our environment and the food that, is pretty common nowadays is not aiding in this healing journey. And so we have to be so on top of things to ensure, coming back to water, the quality of food, ensuring that we are purchasing the highest quality that we can afford. Now, you mentioned peristalsis, and peristalsis, that contracting motion that I know happens down there, but it also happens in our esophagus to kind of move that food down. One major question that I've received from individuals when they're cautious about colonics is, and it reminded me of peristalsis, but I know that there's like involuntary and voluntary movement of like excretion. So eliminating bowels. And many individuals think that getting a colonic will lose or lessen our body's ability to excrete waste. And so I'd love to kind of talk about that and pull back some of the layers on that.
Perfect. It's a great question. So people ask me, will I always need colonics? Heck no. I want people to be able to poop on their own. And so really, legally, there's only 3 things that I can say colonics do. They hydrate your bowels. A hydrated bowel is a healthy, happy bowel. They evacuate your bowels. We get that old waste out. That old waste is not doing you any favors, right? It's blocking you up. It's sucking your energy. They also stimulate your bowels. And what I mean by that is as I slowly put the water in, the water acts like a weight. Just like when food is moving through your body, when food hits a certain section of the bowel, it contracts, right? So the water acts like a weight and it stimulates the bowels to move. So basically, I'm giving you a Pilates or CrossFit workout in there. So the idea is as the water moves in, the peristalsis happens, we're toning the bowels. Many people who have had chronic constipation, their bowels are lazy. They're weak, just like if you hadn't exercised in 10 years. So the idea is to not only tone your bowels and bring the muscles back to where they need to be, but also, is your bowel kinked? Is it puffed out? Is there a constricture? We're like kind of fluffing it out and creating that beautiful bowel picture that you see in anatomy books. Most people's bowels don't look like that, if you have some kind of scan. So it is the opposite. I'm my own N of 1. Like I said, I've done more colonics and enemas than anyone I know. I'm a big proponent. And I have great bowel health. I evacuate and eliminate way better than I ever did. I can eat all the foods that I want to eat. And honestly, at 50 years old, I have more energy, more vitality, more zest for life than I did in my 20s, 30s, and 40s.
Absolutely. And I think that's a testament to what you're doing, what you're putting in your body, your digestion and excretion. Absolutely. And so I think that really did clear things up. And it almost seems, from what you said, it's the complete opposite. This is going to help stimulate and it's going to help strengthen that movement in that peristalsis. Now, I have a situation to throw out to you because I got into this. I mean, this whole season on the podcast is all about digestion and gut health. And for somebody who has dedicated so many years into healthy diet, lifestyle eating, been in the hospital since I was a little kid, but really utilized Eastern medicine to not only heal and thrive. Background with Lyme disease, PCOS, SIBO, H. pylori, all those different things. My digestion has never been so bad. And what's interesting is, and I'm sober, I eat healthy food, all the different things that you can think of. I've really dedicated a season to balancing my blood sugar and really, really dedicating, wearing CGMs. And I used to be severe hypo, like go into the 40s. And so I've, made sure I've been pretty low carb. Have you had a lot of clients who have experienced some of these issues with gut health, with digestion and constipation, who are these healthy individuals? And maybe they pulled back too much on the carbohydrates. Maybe they've obviously reduced their diversity. What is kind of your experience with some of these clients who are coming to you and they're like, I'm doing all the things, yet I'm still struggling?
So one word, cortisol. So cortisol is one of the biggest things I talk about. 95% of my client population is female, right? Same thing when I was a yoga teacher. And I think it's women are more proactive with their health, right? And we're more apt to go do something like this because we go to the gynecologist, we have babies, right? So we're used to more procedures. Cortisol is enemy number one in my office, right? I was stuck in fight or flight the first 40 plus years of my life. The first 5-6 years of my health journey, I saw lots of wonderful male functional medicine doctors who pushed me really hard, right? And what I didn't understand then is if you are in the sympathetic mode, you are not going to be able to heal, you're not going to be able to digest, and you're not going to be able to regenerate, and you're not going to be able to have good digestion, right? So the body doesn't differentiate stress. It doesn't know that, oh, my job is stressful, or I'm eating terribly, or I'm not sleeping, or my kids are driving me crazy, or I have heavy metals or Lyme. Cortisol is cortisol. The moment you have elevated cortisol for extended period of time, your digestive enzymes in your mouth go down, your HCl, your hydrochloric acid goes down, and your peristalsis stops because your body's trying to send all your energy to your heart, your lungs, your legs, and your arms so you can run from whatever that stressful event is. So my own personal journey and the journey of a lot of my really regular female clients, they tend to be high functioning, super fit, super doing kind of women who have histories like this. But a lot of us also have childhood trauma. So cortisol is a really big piece of it. And it has taken me a very long time. And that was part of my move and moving out of nursing profession, moving to a place where I don't have to work full time. If you live in California and you want to own properties, like I've been able to move to a place where I have rentals here, and so I have a lot more passive income coming in. Don't do any cardio. I mean, I live in the mountains, so I walk. That's cardio. But I strength train. I prioritize sleep, eat an anti-inflammatory diet, and I don't participate in the predatory healthcare, sick care matrix. So I think cortisol is a big piece of it. I'm really careful not to set blame on people. I think we have enough shame, enough blame, but we live on a planet that is messed up. It's dirty, and there's a lot of exposures that we cannot manage. I was a healthy human being. It's not like I was like out, living a super unhealthy life, but I also worked in an acute care hospital for almost 2 decades, a lot of exposures. Who knows what your exposures were? You have a body burden story, however old you are, every house you've lived in, every lead pipe, every vaccine, every single thing that your body's been exposed to, it has created a body burden story. And some of us are more sensitive than others, and I'm very sensitive to high cortisol. It stops my digestion immediately. And so I've had to, as I've gotten older, really regulate that. I'm not a big fan of fasting long-term for women. I'm not a big fan of low carb for women. I fast 12 to 14 hours every day from the time I have dinner to the time I have breakfast. That is my fast. We need to let insulin drop. We need to let the digestion rest. But when I get up, I make sure to have 30 grams of protein within an hour. I don't work out fasted. And I don't fast for long periods like I used to. My functional medicine doctors used to have me fast for 3 days, to
Wow.
autophagy, right?
Mm-hmm.
So we just have to kind of meet ourselves where we're at. We as females are different creatures. And especially if you're in perimenopause or beyond, because when your ovaries retire, your adrenals are going to take over. If your adrenals are maxed out and crashed and your ovaries retire, there's nobody to pick up your daily hormones because that's who does. And so now you have this crazy fast drop in hormones and your adrenals don't pick up. And so now we have more hot flashes and more insulin resistance and more inflammation than we would have if we went into it with lots of muscle, with solid blood sugars. Estrogen is one of the most anti-inflammatory things in the body. So to combat that, I have not gone into menopause yet, but I eat a very anti-inflammatory diet. So when my estrogen does drop, I won't feel that as much. You see a lot of women in perimenopause. Oh my gosh, my joints hurt. I'm constantly getting injured. And that's because estrogen is dropping, right? So we could talk a lot about that, but we're here to talk about colonics.
There were so many incredible nuggets in there, and I'd love to, jump on another time and just dive down this. I mean, your wealth of knowledge, you simplified the material, and I think you've tried different approaches. You've been the N=1. You've experimented that. You've had the Western background, the Eastern background, and you've looked at your life and your health, and you've made those smaller changes, but the bigger changes to uproot and move to a location that is going to serve your body. Because I think sometimes, and I have some of my closest friends are registered nurses, they're a PA, and it is some of the most stressful jobs I've ever heard of. And you're in a facility that is supposed to heal, and the work that they do is incredible, but the health implications that are weighed on them. And so to be able to completely uproot and change your life like that, I think is a lot to say. And sometimes you have to make those moves in order to heal, in order to thrive. And I think you nailed it with the cortisol. I mean, I think most people who are listening, I know our audience is primarily women. And if you're listening to a podcast, generally you're seeking to learn. You want more information. You're probably type A. You're a go-getter. You want to learn. You want to, move the needle in some way or another. We probably are all naturally go-getters and probably have a lot of cortisol kind of running around in the body. So we have to be pretty conscious about the things how we're filling our day, what we're doing, how much stimulation we are including in our day and how much breathing space and rest we are including in our day, because it doesn't matter how clean the food you're eating. If your nervous system is dysregulated, all these other components can start fraying and get out of sync. And so, yeah, I think it's absolutely important. So you mentioned moving to a new, slower pace of life. Were there any other major components, reducing the fasting, probably including more carbohydrates, pulling back the cardio? Were there other things that helped minimize your cortisol spikes?
Getting good sleep. Just like a lot of people, I wear an Oura ring. Mm-hmm. I've worn it for 2.5 years, and it has been huge to get better sleep. I've learned a lot about, better sleep, less cardio, more protein, right? Because you want to have better blood sugars. And just like you said it perfectly, just being intentional about the things that you allow into your space. For probably 8 years, every doctor that I saw, I said, there is something causing anxiety in my body. It wasn't mental. It wasn't anything. I knew that there was something not right. And getting rid of parasites, and I'm still in the process. I'm doing deep heavy metal detoxification through mineral balancing, has changed my nervous system. Mm. And if you wear an Oura ring, you know that it does a resilience score, and it tells you about your stress. And I have data to show that the more heavy metals I've eliminated, the less stressful days I have, the better my resilience is. And that constant humming, not pleasant humming in my body has almost been eliminated.
Absolutely.
Right? So, I mean, when people say, how did you heal? I was that person that was not going to heal. I've been to conferences, workshops. I've been part of healing groups. And there was always those people who have these miraculous, like, I did this one thing and now I'm healed and I'm so much better. I was that person always left that like, why am I not healing? You know, I had to do it all, you know, and about 5+ years ago, I really took my wellness in my own hands. I just said, you know what? I need to stop listening to other people. I learned how to muscle test, and I just started sweating in my sauna religiously. I started doing coffee enemas, more coffee enemas than, you know, I probably want to admit that I did. But every time I did them, my brain fog was going away. My chemical sensitivities were going away. My food sensitivities were going away. I parasite cleansed for like 3 or 4 years, you know, and I still do it very regularly. And now I've been seeing a mineral balancing practitioner for almost 1.5 years. Huge reduction in physiological anxiety. I don't know if you can relate to that, to where everything's fine, but I feel anxious on the inside.
Absolutely. I mean, I kind of connect that back to adrenal dysfunction, and especially like you mentioned earlier, childhood trauma. If we are not getting to the root of that and healing that, and I think trauma is, I mean, you carry that with you unless you start working through it. And I know that there's different things on like, is there adrenal testing? And back in the day, I had stage 3. And so really diligently working to heal my adrenals, pull back the fasting, add more carbs, add more rest, healing. I think there are seasons to life, and when we need to slow down and when we're in a place that we can amplify things. And I think that's so important. And I just wanted to, you know, piggyback and throw this out to you because you mentioned sleep is so important. And I think we all know that. But so many people are like, I don't have the option, or I only have this small of window to be able to do it. Listen, not that I'm like a perfect case, but I have a 15-month-old and she's up at 5:45 every single day. And I have the Aura Ring, and my sleep score is usually between 94 to 96. Sometimes I get 98. I dedicate myself to quality sleep. My husband and I are in bed every single night religiously at 8:30 p.m. And it's crazy. It's like people would look at us like, what? Like, you know, most of the time we're turning off the TV at 10 p.m. But I know how important sleep is. And there's certain things out of my hands, but I know the quality of sleep. I mean, that is your time for rest, restoring, detoxifying, all these different components. And so we can make different excuses and blame certain circumstances. And I'm sure, especially with the registered nurse, hours are crazy. But I think taking the things in our hands that we do have control over, putting away the excuses, and that might mean, well, I don't get to watch TV today. I put the kid down and it's pretty much to bed right after. I think if you're in a season of healing, one of the best things you can do is prioritize your sleep. And that might look like deprioritizing every other thing. But I mean, I would say religiously, my sleep score is 96, which I would say that's a pretty good one.
Yeah. I love it. I love it. I love it. So I tell my clients, everything you do either adds to your health bank or withdraws from it. And I always ask people, what's your goal? My goal as a 50-year-old female is to age powerfully. I want to be strong. I want to be fit. I want to be able to paddleboard when I'm 80. I want to be able to lift my paddleboards onto my car. I also don't want cancer, and I don't want dementia. So I act accordingly, right? So what does that look like? Strength training, blood sugar regulation. Alzheimer's is type 3 diabetes. Okay. And sweating in my sauna. Dr. Amen from the Amen Clinic said after hundreds of thousands of brain scans, sweating is the best way to detoxify the brain. So in our family, we all sweat regularly. I'm from Finland. I'm definitely very biased towards it, but the research is pretty clear as far for cardiovascular health and dementia. And so I tell my clients, just act accordingly. No one's coming. No one is coming to save you. I had a 25-year-old client saying, oh, I want to be like you when I grow up. I said, you do not wake up a fit and fabulous 50-year-old. You do not wake up a fit and fabulous 70-year-old. That is created and cultivated the decades prior to that. Sleep is like, I protect it like it is my job. When you are unwell for 8 years, like I was, I'm never going back there again. So I work my self-care like it's my job. Like I love feeling great. I don't think people know how good you can feel. Like do you remember when you were a kid and you're just skipping down the road and you're feeling really good? Like I'm finding that in my body just doing dishes or just doing like the mundane things that like joy that happens when you have clean flow going through your body. I'm not saying I feel amazing every single day, but if I feel great 90% of the time, I'll take it. Chronic illness is a joy thief. It removes all hope from your life. And I felt like I lived behind a glass window watching the rest of the world enjoy life for years. There was a moment in time where I could only eat 8 things for 2.5 years. If I ate anything else, my brain would react so intensely. And there's a really big neurological component to Lyme mold and all those things. And the fact that I can eat well, I can go out to eat, I can be in public, is amazing. And so I don't think people know how good they can feel because you can feel amazing at any age. We have this whole story going on. When people tell me, oh my God, I feel a little old at 35, I was like, that's not an age thing. That's a mobility and lifestyle thing. And that is not shaming and blaming. Everything I say is from total love because I wish that I'd had the support that I am able to give people. I do this. I dedicated my life to service like this when I felt better because I want other people to experience the joy of finding good health again and being able to maintain it.
Absolutely. I keep smiling because everything you say is just so powerful. The information that you provide, I think this is what people need to hear. And it reminded me too of, I've had people in my life say, well, my buddy has high cholesterol. My buddy has this. Just because it's common doesn't mean it's normal. And I think we need to change that narrative. Like what is normal is actually thriving and feeling great. And so how do we put things into place to be able to feel that way? Now, I've pulled so much incredible information from you today, Katja. Where can people find more information about you, whether that's through social or locally at your location? Please, this is your place to share.
So you can find me on Instagram, just Cleanse Asheville. I share cleansing tips. I also talk a lot about metabolism and just the reality of like how to live a healthy life. I also did a food blog for over a decade called Savory Lotus. So if you're more interested in healthy living, and I do more of my strength training stuff there. So Savory Lotus on Instagram. If you want to go to my website, it is very clear and explains colonics, as well as I can on cleanseasheville.com. There's an FAQ page that answers all the big questions. Is it going to hurt? What's going to happen during a session? All those things. Can I have a colonic when I'm on my menstrual cycle? So you can go to my FAQ page. There is a pre and post care page also. So if you can see like, what's the prep? What does it look like afterwards? I do have an office in Asheville, North Carolina. I'm usually booked out about 4 to 6 weeks. So I do have lots of people who come into Asheville and want to see me. Hit me up ahead of time and we can get you in. I do require a phone conversation before any colonic. Having a nursing background, safety is my number one priority. I want to go through contraindications. So if you want to talk about contraindications, that's something we can talk about for a second if we have time. But
Sure.
I go through a list of contraindications with people and I just make sure it's a good fit. And I want people to have realistic expectations of what we do here. It is a friendly, clean, sanitary, loving, Zen, parasympathetic experience. Because if you are in high stress sympathetic mode, you're not going to let go. So if people are curious, go to my Google reviews. I have tons and tons of 5-star Google reviews where people really explain their experience. So I know it's a very vulnerable thing to do, to go to a perfect stranger and ask them to flush out your bum, right?
Absolutely.
So if people are looking in your area, I get a lot of DMs. How do I find someone in my area? Google colonics in your town, colonics Denver, colonics San Francisco. Look at their websites, go to their social media sites. Just see if they resonate with you, their energy. Look at their Google reviews, look at their Yelp reviews. I'm always open. If you find a colon hydrotherapy office, you want to Instagram me their website, I will kind of like suss it out and just tell you what I think. I am trained and certified through IACT, International Association for Colon Therapy, IACT. So when I see that somebody was trained in that way, then I know that they have gotten the proper training and safety. But, my favorite colon hydrotherapist is in Oakland, California, and she's not certified by that. She just tends to be a great colon hydrotherapist. So most colon hydrotherapists are interesting, caring, kind of quirky people. You kind of have to be. It's not like it's this glamorous job. I don't do this because I want to plumb people out. I do this because it is a gateway for me to be able to educate people about clean living. You cannot just do a bunch of colonics and still be living a lifestyle of fast food, fast living, sympathetic overdrive, drinking alcohol, and what's the amazing thing is when we start to get those little wins of feeling better, feeling a little bit better here and there, then we get more motivated. Hey, I've seen a lot of my clients make big strides, and I see my clients not. Everyone is on their own healing journey. The hardest thing for me as a practitioner is to see people not follow through. And that's something I'm still trying to understand. I know we all have a lot of different variables that keeps us from optimizing our wellness. But, for somebody like me, when you lose your health and you regain it again, it is the ultimate motivation. And I want to be healthy, happy through my 60s, 70s, and 80s. And, most people spend the last 20% of their life in poor health. That means if you live to be 79, after 60, you're in poor health. My husband and I, we're not doing that. We're just not doing it. So.
And especially if you have kids and grandkids, this is your opportunity to thrive. You're probably in retirement. Like, this is your fun chapter and season of life, to play and to be able to do all this. So to be able to have quality health, I think is so important. Well, Katja, this was incredible, and I so appreciate your time, your energy, your input. Make sure to follow her on Instagram. I'll make sure to include all her information in the show notes. But I so appreciate your time and energy, and thank you so much for being here.
Oh, super fun. Thank you.